Good afternoon. This is Vicki, Soule, and welcome to Community Conversations. Community Conversations gives us a chance each week to bring you information about local events and contributions made by those that improve the quality of life along the Treasure Coast. Community Conversations is sponsored by Treasure Coast Community Health, also known as TCCH. As their CEO, I am proud to recognize that TCCH also improves the quality of life here in Indian River County by providing primary medical, dental, and behavioral health care to all people. Community Conversations this week is produced by Cindi.
Hello.
Hey, Cindi.
How are you today?
I'm wonderful. This is our first time together. And as we were laughing as we came into the studio, hopefully there'll be no confusion because one of our two wonderful guests today is also named Cindi.
Yes.
Cindi Green, the Director of Marketing and Community Relations at the Florida Eye Institute.
Hi, Vicki.
Hey.
And hi, Cindi.
Hi. Hello.
This is like when you go in the store and somebody yells, "Mom!"
Right. Right.
And with us today also is Colleen Symanski, who is an RN, a certified diabetes educator, and the owner of A Healthier Me, a diabetes education, coaching, and fitness studio. So today we're going to talk about a symposium, a diabetes symposium that's coming up very soon.
Right. We are very excited to present this. This is our fourth year, Vicki, of hosting this diabetes. We call it Diabetes Head to Toe, because people will really learn about ways to manage diabetes literally from head to toe with the speakers that we'll have available.
It is an amazing disease process in that, unlike many others, it really does affect so many different organs at different times and in different ways.
Right.
That you guys are really sort of touting the let's get to know about it before it affects you, because an ounce of prevention is worth
Absolutely.
a ton of cures, right?
Absolutely.
All right. So I know Colleen, this is her life, diabetes all the time, right?
It is. I do have a passion, and I'm still going at it.
You've been here in the Sebastian area for some years now.
Yes. I started out, I think, about 6 years ago in Sebastian.
Yeah. Treasure Coast Community Health has sent patients to you because despite the fact that we try to have everyone understand everything we're trying to say, it's like why God gave us two parents. One might
There's a lot of
connect
moving
little bit
parts.
different. Exactly.
There's a lot of moving parts in this condition. And Colleen and I have known each other as professional friends for years and years. And we were speaking about this one day. And, of course, coming from ophthalmology and Colleen coming from becoming a diabetic educator, it was clear that our community members really are overwhelmed with the aspect of being diagnosed with diabetes and learning that they have a chronic disease. And we wanted to create something or find a way to be able to provide some great information for people to help them with that feeling. And then to also make sure that it could hopefully be a little more compliant in their care and seek out the specialists or the care that they needed. So
the first event was in Vero, Sebastian?
Yes, I think we were trying to go back in time and remember. And we believe our first event was 2013, and we held that at Florida Eye Institute. And one of the reasons is that over the years we've really kind of outgrown our room. And how exciting is that, right?
Yeah, so you're going to have a bigger and better symposium this year.
Yes, we are. And then in some of the past years, we've split it up and done one event in Sebastian at the library and then one event at our Florida Eye Institute in Vero Beach. But we have a beautiful, beautiful opportunity to have it at the First Presbyterian Church. They have a lovely, large and very modern community center. I think a lot of us have been there for other events, and so we've decided
you really
need to. It has great state-of-the-art audiovisual equipment, lots of room.
Lots of parking, easy to get to off of Indian River Boulevard.
Get into, drive into, pull into. So our dream was to really kind of hold it there and be able to also offer different information. This is the first year we'll actually have some what we call the expo portion, which will be resource booths or information booths from local community providers that offer lots of information and services to help those with diabetes. We're going to have some free screenings that include vision, foot screening, dental screenings, and just chock full of information for people to take away.
So it's not just for individuals who've already been diagnosed with diabetes. It's for those that might have a family member,
Sure.
somebody that they fear has some of the warning signs. I can remember even as a young woman, if you had excessive thirst, there were a couple of triggers that people would say, if this, or this, you might have diabetes, you should check things out with your doctor.
Absolutely.
Colleen, help me out with those.
Right.
No, you're right. Increased thirst, increased urination, the visions. Sometimes people will notice their vision isn't quite as clear as it used to be.
Subtle little signs that could be related to other things, but again, it was sort of the rules of three. If you had two of the three, maybe you should check it out. So folks who either are in that situation themselves, and of course, none of us wants to say, yeah, that's me. I now have a chronic disease. Oh, my heavens, no. Okay.
Right.
None of us really wants to step forward and admit when things in our body are going wrong.
Right.
Okay.
Right.
Because it's going to change our life.
Well, and since we know, what's the figure, Colleen, that 1 in 4 by 2000?
Right, we'll have diabetes or pre-diabetes, and that's probably one of the most subtle is the term pre-diabetes.
Don't we love when Dr. Graham talks about that?
Yes,
you know what I'm going to say, right?
Yes, it's like being pre-pregnant.
Yeah. So he's So a lot of people want to, if their doctor has told them that they're pre-diabetic or have metabolic syndrome, they might be breathing a little sigh of relief, thinking, "Hey, at least I'm not diabetic." But they are definitely on that path or in the very beginnings of what we would call, early diabetes. In fact, they're either trying to rename that pre-diabetic
to stage one diabetes,
right.
Because by the time somebody's diagnosed with pre-diabetes, until they really do something active when they get diagnosed with diabetes, you have 10 years of subtle damage that's already been done to the tiny capillaries that affect your eyes and
kidneys,
your
legs, feet,
eyes. Yeah. So stage 1 makes me think automatically of cancer. And 20, 30 years ago, we didn't even want to say the C word. But certainly we figured out as a culture, as a community, that the earlier we find something, like stage 1 cancer is like, I can deal with this, okay?
Right.
Stage 4, not so much. None of us really want to get to stage 4 diabetes or pure diabetes.
Right.
Right. No, we don't. Stage 4 is you're probably looking at dialysis, a stroke, probably
perhaps amputation, toes.
Okay. So time for action, folks.
Yes.
Sounds like you've got 4 hours coming up on November 18th.
Yes.
Between 10 o'clock and 2 o'clock, if you travel on over to the First Presbyterian Church in Vero Beach. There will be lectures that start at what time?
Around 10:30.
Around 10:30. So when should people come?
Doors are going to open at 9 because we have so much resource information available. We want people to be able to visit the tables and speak with our local providers and get all the information they want. Plus, they can get their blood pressure checked, their blood sugar, have a vision screening, look at some diabetic footwear, just get lots and lots of information. So we want them to have time to be able to do that.
Now, I know this isn't quite in your area, but why would diabetics need footwear?
Well, if as a disease progresses, many people experience a condition called neuropathy. So that means they have tingling or unable to have full sensation in their feet. So it is imperative that they protect their feet and wear very good and what am I trying to say, Colleen?
Well, that
footwear,
they're actually wearing closed, supportive footwear, clean, white socks, understanding their risk of having a wound that they may not know existed. So it helps protect that. And especially here in Florida, when we really like to wear sandals or flip-flops.
And we get stones and twigs and thorns.
Right, and we want you moving, and you can move better in
got
proper
good
footwear.
shoes, right?
Okay. So, well, I just thought, footwear, all of a sudden we're a fashion plate? No, it's really protective.
Right,
Right.
yes.
Awesome.
Right.
So I think I'm going to prompt you on this because Treasure Coast Community Health, of course, sees a lot of people who have insurance issues or no insurance. And so cost is always a consideration.
Sure.
Tell us the best part of this.
It's free.
Free. All right.
The most powerful word ever.
And it is sponsored by Florida Eye Institute and A Healthier Me. So there's a lot.
But screenings are free, information is free, and we really want people to come out and learn something that day and have a takeaway.
And they need to. We would prefer that people RSVP so we have enough lunch, and a healthy lunch is going to be provided or made available at $5 per person, and we've made it just the perfect healthy lunch.
So why don't you guys give the listening audience that phone number? Grab your pens and pencil. I always have something for you all to write down out there. Get a number so that you can take care of that, and then we'll take a short commercial break.
The phone number
for
the Florida Eye Institute.
I'll give you that right now. That is 772-569-9500. Very easy. 569-9500.
Now, those of you that wonder, we don't rehearse this. Can you tell?
Yes.
This truly is a conversation of
live,
a bunch of
live,
women.
And they're going to be RSVPing for the Diabetes Head to Toe Community Symposium Health Expo.
Yes.
Okay.
That's how you do it.
Awesome. We'll be right back.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
ITEX, or International Trade Exchange, is the largest barter company in the world, with over 25,000 members offering goods and services. We're a marketing company that brings you new business in the way of trade, with over 200 local members enjoying the benefits of ITEX, like lawyers, doctors, plumbers, media, printing, and more.
Hi, this is Liz Bowler. Contact me and find out why barter through ITEX has been smarter for over 30 years. 772-532-1881. Visit itex.com.
Hello, I'm Chris Hudman, formerly of Bugmaster, now co-owner of Compass Pest Control. CompassPests.com. Compass provides a complete range of services, including lawn and landscape, termite prevention, and structural pest control for both residential and commercial clients. Find out why friends and neighbors are choosing a new direction and moving to Compass Pest Control. Call Compass at 772-413-1647 or visit CompassPests.com.
Beachland Cleaning Service has grown to become the area's premier janitorial service provider. Our service area extends from Melbourne through Fort Lauderdale. Our staff has more than 80 years combined industry experience. They're skilled, technically trained professionals who undergo continuing education so they can provide service that exceeds industry standards. Experience the difference. Call us today, 569-0799.
Beachland Cleaning is a member of the ITEX trading community. Your ITEX dollars are welcome.
And welcome back to Community Conversations with Vicki Soule from Treasure Coast Community Health. Now, as everyone probably knows, Treasure Coast Community Health is very invested in your good health. And so today we have Cindi Green from Florida Eye Institute and Colleen Symanski from A Healthier Me, a certified diabetes educator and RN, who are talking about the 4th annual Diabetes Head to Toe Symposium and Health Expo.
Right.
The bigger and better version.
Bigger and better. Don't miss it.
So we were talking about this will be the first time this event will be held on November 18th at the McKee?
At the McAfee Hall
Okay.
at the First Presbyterian Church in Vero Beach.
right there at Royal Palm
Boulevard,
Indian River?
And
Okay.
Indian River Boulevard.
Okay. So you guys have moved this every year. Has this been a learning experience?
Yes, it has. Yes, it has. And that, frankly, this a couple years ago, this was our goal. We had our sights set on this, and actually wanted to have it there last year. And there were some conflicts with the dates, and we just didn't get to it with the appropriate time. But this year, made sure to get that all locked up early, and are delighted to be hosting it there because, frankly, we ran out of room.
Right.
We used to host it at Florida Eye Institute in one of our very large waiting room areas where we typically do seminars, and we just ran out of room. So
I'm grateful that you did because I've been there twice. It is a wonderful hall on the first floor. They have a raised stage so your speakers can be seen by everyone. It's just a classy place, and it's large enough for both tables and tables around the edge for individuals to see, talk, be screened,
and meet with our providers, our information providers on diabetes. So yeah.
And Colleen, you were saying something about your goal, your vision for this is not just to put more stuff in people's heads so that they kind of walk out going, more in the info basket that I don't know how to deal with.
Right. I call that the diabetes overwhelmness because there's so much information. So our goal is that people come away, walk away with tools for what they need for themselves. It's personal. There is no one size fits all. And
no magic pill.
And no magic pill.
Unfortunately.
Right.
Okay.
So, and we also want people to see some of the positive resources that are available to them, and not just finger sticks and glucometers, but they're the resources that are available to help them feel better and reduce their stress.
Well, and I know that this was not your intention, but I'm going to probe this just a little bit more because as the owner of A Healthier Me, you have paired up with someone who's really into the physical side of health.
Yes, I have. Thank you so much. Actually, I paired up with a fabulous personal trainer. He is my son.
He is the best.
He is my son, but he's fabulous. And the mission there is that we can work with people with type 1 and type 2 diabetes. So if we have athletes, Kenny can go run with them. And we monitor blood sugars before, 15 minutes into, after, see how they need to fuel up. So
Fantastic.
We are not an office-based only. We bring it to the streets. We bring it to the grocery stores.
And unfortunately, I'm pretty positive that there's more of us that are not regular exercisers than the runners out there.
Right.
I could be wrong,
but it's even just functional movement.
Okay.
People don't functionally move enough. So we will get people, and I'll go take them for a 10-minute walk, and they'll see a 20 or 30-minute 30-point drop in their blood glucose. So if I can get people moving 10 minutes 3 times a day, they're doing better with glucose control. And I don't really like that word, glucose management. And our goal is to get you within ranges as opposed to spikes. People need encouragement. Oftentimes they come in there, they're discouraged already. They think they've tried everything.
Absolutely.
And they haven't because they haven't been to us.
Can I ask a question about that, Colleen?
Oh, sure, Cindi.
Why does that happen? Why does 10 minutes of exercise really take a great aspect to your glucose?
Because glucose is utilized by the muscles for energy.
Okay.
So if you use it just enough, you'll be using up some of the excess glucose that has trouble getting into the cells.
Okay. And it's that easy. 10 minutes 3 times a day.
It's that easy.
Wow.
Wow. Okay, we're all sitting here. Well,
We're changing the world already.
Wow.
Yay. And that's what
There's a little blush of disaster here on my face. Like, really?
and that's even what the National Diabetes Prevention Program is saying is 150 minutes a week, 30 minutes a day, and 10-minute increments is effective. And we show clients that it does work.
10 minutes at a time, I could probably match. It's the 30 that feels so overwhelming. Like,
exactly.
Some days I feel, as a mom and grandma, I don't even have time to brush my teeth. How could I possibly squeeze 30 minutes?
Right.
You know? But 10, It's probably
that's
manageable.
doable, right?
Yeah, and
Right.
if you don't hit 3 right off the bat, that's okay too.
Right. That's what I love about Colleen is she is able to give people information that they really can use.
Yeah.
And when she says we take it to the grocery store, she literally means that. She will grab you by the hand and take you to Publix and walk through and show you what to put in your cart. And then she will also be with you while you're trying to figure out, how do I make these things in my cart work for me? Then what do I do?
That's
How
where
do
it
I
sounds
prep?
way too complicated. Counting calories and
how do I
checking
prep?
everything
What do I need to do?
over
What
and
do I
over.
need to plan for?
Right.
Does a pantry clean out for people? Just really, really gets to, literally where they live.
Right.
And those are some of the messages we want to get across, that with this diabetes overwhelm us, we can break it down for individually to small things that you can do. And if you do them on a regular basis, you're going to see big, big changes.
Well, here's a anecdote. Our dental hygienist has been going out working with the community more and showing on a little bulletin board, the sugar level of various drinks.
Right.
And I said, well, that's all fine and good, but, I'm not a big soda drinker. And he said, but do you brush your teeth 3 times a day? Do you know what the sugar level of people who don't brush their teeth regularly is likely to be like because of the plaque and the things that I hadn't even considered?
Had thought of, right.
So, those are the magic moments, those little kernels that you get out of an interaction that make the rest of the time that you've spent so worthwhile, because if you hadn't attended the symposium, you wouldn't have gotten
wouldn't
it.
know that. Right.
Exactly.
And that's all we want. If someone can walk away with 1 or 2 great tips, or a light bulb goes off that I didn't know that, and now I feel empowered to be able to take charge of my health, that's really what drives Colleen and myself. That's what we're looking for.
Right, and how to put it together, because they are working with their specialists, their eye doctor, their heart doctor, their foot doctor, their kidney doctor. They've seen the RD. Now we're going to help you put it together.
Put it all together.
And make it work for you.
And for those that haven't gotten on the specialty train yet, primary care is the best place to start.
Absolutely.
Treasure Coast Community Health is a primary care facility. You pick your own doctor. You have appointments. It is not a clinic. It is a health center that has integrated care, team-based care with all the specialists to really, again, bring a better, healthier you
And
to the
primary
table.
care is so essential, Vicki. That's where most people find out that they have diabetes. Primary care work with people, with their patients, to make sure that they don't, or they can delay seeing a specialist. The goal isn't to get you to go get the complication.
Right.
We want to
It's
prevent
right.
Yay to primary care and the Treasure Coast. You guys do awesome work.
Well, and we see it starting as many have over the last 10 years, younger and younger, whether it's lack of exercise, the increase in technology, the fast food phenomena, whatever you want to blame it towards. It's really not a blame game. With our children's health at stake, even if we don't feel we can manage our own health well, I don't know of a parent in the world that doesn't want to help their children.
Exactly.
So again, this is all information that's going to come out. Endocrinology, internal medicine, what other folks are competing?
Podiatry, which is feet.
Okay.
Complicated word for the feet. And ophthalmology, which is a big, long word for eye care.
Okay.
And then we also have this year a licensed mental health counselor who will speak on diabetes and depression. Because, our mental aspect affects so much of what we do. And when you're told that you have an ongoing chronic disease, that can lead to a lot of scary, scary complications, that's a good part to address. And then, of course, our own Colleen will be speaking on how to put it all together. As she said, she's got a great presentation.
So she's going to be the wrap-up just before 2 o'clock, eh? Okay. Lunch will be noonish?
Noonish,
Okay.
And that'll be diabetic-appropriate lunch available for $5. Really nice.
Okay. So before we run out of time, one more, the phone number to do the registration and
give us a
order
call.
lunch for $5.
You can. It's 772-569-9500.
Okay. No website.
Yes, you can. You can register online at Florida Eye Institute, which is fleye.com. So we hope to see you there.
Yeah, and I'm sure Colleen is just sitting here with a big grin.
Can't wait.
She can't wait.
I know that's my job, is to smile on air and get there on the 18th.
Well, we hope to see a big crowd out there because it sounds very beneficial for our community. And we thank you and all of your sponsors and your speakers for putting this together. And thank you, our guests, for being here and listening to this. We appreciate it. And tune in next week. Have a great evening. Bye-bye.